Hi, thanks for joining us. You're watching Health Matters. I'm Renay Rouse with the Florida Department of Health in Martin County. Our mission for this show is to give you important and urgent information that affects the health and safety of you and your family. You may have heard that a public health emergency has been declared for the state of Florida by the State Surgeon General. Some counties in Florida, including Martin County, are considered critically impacted by the rise in cases of hepatitis A. Many states in the U.S. are also experiencing outbreaks. Hepatitis A is a contagious virus that infects the liver and can lead to serious liver problems. While normally not fatal, persons with chronic disease, compromised immune systems, and the elderly are more likely to experience severe illness and possible death. The best defense against hepatitis A is to get vaccinated and practice good hygiene. Alcohol-based hand sanitizers do not kill the virus. Using soap and water to wash hands is key, especially after changing diapers and before preparing, serving, and eating food. The hepatitis A vaccine is available in the community via healthcare providers, local pharmacies, and the health department. The health department in Stewart on Willoughby Boulevard offers the vaccine on a walk-in basis, Monday through Friday. For more information, call the health department at 772-221-4000. To learn more about hepatitis A in Florida, you can go to floridahealth.com/HepA. Also, the Florida Department of Health has set up an information line to answer your questions. That number is 1-844-CALL-DOH, which is 1-844-225-5364. And now, on to our big story. Children are now back to school, meeting old friends and making new ones. And it's imperative to protect your children against harmful diseases. Protecting your child against disease all starts with making sure they receive the recommended vaccines on the regular schedule, starting as babies. Bob Hoganson tells us more about how vaccines can protect children and adults from serious illness or death.
This is called our vaccine room, and this is where we house our vaccine, and we have all different kinds from the children's vaccines to travel vaccines to adult vaccines.
Nurse Program Specialist Diane Wright shows the arsenal of defenses the health department stockpiles for use in the community.
We have the Tdap, which is right here, especially for the children going into the 7th grade.
She says vaccines are an invaluable tool in fighting today's diseases.
We want to prevent children from getting any kind of preventable diseases that we possibly can, and this is our best defense against those diseases.
100 years ago, disease outbreaks may have been contained to one geographic area. However, now with the ease of air travel, diseases can spread without borders.
So there's measles and stuff that are coming back from other countries, and we want to make sure that our children are protected so that they can go to school, they can learn and be healthy.
Parents that do not vaccinate their children are putting others at risk, says Diane. Something called a herd immunity will protect those children that cannot get vaccinated due to some medical conditions.
Maybe they're on chemo, they have cancer or something, but we as the community will go ahead and herd and protect those that are vulnerable that can't be vaccinated.
According to the Center for Disease Control, before there was a vaccine against it, measles would infect nearly 4 million Americans every year. With the vaccine, measles was declared eliminated in 2000. However, now in 2019 alone, the disease is coming back, with cases reported in 30 states.
You need to go ahead and vaccinate your children. We want them to be healthy. We don't want them to have disabilities and stuff. We want them to be, productive people in society. So it's very important that parents get their children and themselves vaccinated.
It's important to talk to your doctor about the recommended vaccinations for you and your child. Vaccinations are available at the health department for uninsured or underinsured children. An international travel vaccine program is also available. You can call 772-221-4000 for more information or go to our website at martincountyhealth.com. Have you ever gone to see a healthcare provider for the first time and then realized that you didn't really know anything about them? Well, now it's easier than ever to check the credentials of your doctor. The Florida Department of Health now provides an easy way to check on the licensing of your healthcare professional. Just go to flhealthsource.gov and click on the Verify a License tab. From there, you can choose from a long list of many professions. Enter as much information as you can and click Search. From there, you can see if the provider's license is up to date and if they have any disciplinary actions and more. Remember, if you're not sure, check for the license. And now on to our health calendar. Living in South Florida, you sure don't need a calendar to tell you it's the summer and it's the rainy season. At this time every year, we get tons of rain, and with that rain brings mosquitoes. Mosquitoes love standing water, and anytime it rains, there is sure to be lots of water left around. Florida's most famous pests can breed in as little as a bottle cap of water, and it only takes a week for them to hatch and become a flying, biting problem. While the county has a robust mosquito control program, it's important that you do your part.
Mosquitoes will bite day and night, so protect yourself with these tips. Keep mosquitoes outside by shutting doors and covering windows with screens. Use EPA-approved insect repellents anytime you're outdoors. Cover your skin with long sleeves and pants. Mosquitoes lay their eggs in water. Just a bottle cap of water is all they need. So drain, refresh, or cover anything around buildings that can hold water at least weekly, and put away outside items that aren't being used. A message from the Florida Department of Health.
Most mosquitoes only fly about 100 feet from where they're born. So if you see a mosquito at your house, that means it probably came from you or your neighbor's yard. There are a few things you need to do to help control the population. Don't leave things out that can accumulate water. Things like tires and pots that don't drain are a magnet for mosquitoes. Children's toys left out and bromeliad plants can also hold enough rainwater to breed those pests. Remember to drain and cover anything that can collect water, and tip and toss anything that a mosquito can lay an egg in. And finally, tattooing is becoming more and more popular among men and women. There are a number of reasons why people get tattoos, but more importantly is the tattoo artist using best practices and clean tools. The health department does routine inspections of tattoo establishments to make sure the work is being done in a safe and healthy way. Bob Hoganson checks in with one tattoo shop in Stewart and shows us how they keep their clients safe.
Look at that tube, that is insane.
That just catches the needle.
No, but I'm saying like...
At Gothic City Tattoo in Stewart,
Oh, God.
a little bit of pain is worth the long-term gain of wearable art in the form of piercings and tattoos.
Well, they were different. Not everyone had them. They look cool.
Scott Borer has given thousands of tattoos in his 16-year career as a tattoo artist. He says it really wasn't all that long ago that tattoo shops were located in only the shadiest parts of town and had a mainstream reputation of being a dark place. However, in recent years, the popularity of social media and alternative television programming has brought the tattoo from the back streets to Main Street in many communities.
I guess that stigma of going into a tattoo shop and it's like bikers or whatever, that was starting to go away. More artistic, there was more art in tattooing.
But with this new popularity came more scrutiny and regulation. Scott and other reputable businesses welcome the increasing attention.
When I think of tattooing, I think of three parts. You have like the artistic side, that's like what everybody knows, like they see the beautiful artwork on the skin. Then you have the technical application, which I feel is more important than the artistic part, because if you don't know how to tattoo, you could have all the artistic ability in the world, you're still not going to be able to put a good tattoo on somebody. But probably most importantly out of all of those would be the public health.
He says that the health and safety of his customers is his #1 priority.
Every person gets a new needle. Once the tattoo's done, those needles are put in a sharps container. A lot of us have single-use tubes. Our machines are sanitized after each tattoo. All the plastics, barriers, they're all thrown away between tattoos.
Only after a lengthy process of coursework and hands-on training can an artist be licensed in Florida. Much of that work focusing on best practices for the well-being of customers.
Basically, it's universal precautions. If you consider everybody to have some sort of a communicable disease and you take those precautions, you're not going to spread anything.
Scott does make the suggestion that when you go to get that tattoo, to do your research. Make sure that the artist has a portfolio you can see, and to make sure that they are licensed in the state of Florida. For Health Matters, I'm Bob Hoganson.
Well, that wraps up this episode of Health Matters. For more information on any of these stories, you can go to martincountyhealth.com. You can also check out and follow our Twitter feed for local and timely health information. You can find us at Go Healthy Martin. Thanks for joining us, and remember, your health matters. I'm Renay Rouse.